Kotek announced this morning that Oregon will be joining Washington and California in their opposition to the policies of the Centers for Disease Control and Prevention.
All three states announced they'll be forming the Western Alliance that will focus on vaccine safety. Fox 12's McKenna Marks joins us live now after hearing from local healthcare providers. McKenna, what's the initial reaction to this big announcement?
Well, Nora, Pete, when it comes to providing safe and effective vaccines for their patients, Oregon healthcare providers in the state tell me that they are in support of the Western Health Alliance. But today's announcement goes beyond just vaccines. This is about Oregon, Washington, and California now distancing themselves from CDC policies.
This alliance is about protecting people, not politics. It's about making sure every person from the coast to the Cascades knows where to turn for care.
The governors from Oregon, Washington, and California made a big announcement Wednesday morning. They will be forming their own independent health alliance outside of the CDC. According to Kotek's office, the Western Health Alliance will focus on vaccine guidelines and recommendations. In a joint statement from Governors Kotek, Ferguson, and Newsom, they said, quote, the CDC has become a political tool that increasingly peddles ideology instead of science, ideology that will lead to severe health consequences. California, Oregon, and Washington will not allow the people of our states to be put at risk. I spoke to pharmacist Pat Hubble, who has owned Brooklyn Pharmacy in Milwaukee since 2017. Hubble says if the Western Health Alliance means his patients can have access to safe and effective vaccines, it has his support.
I think it's a great idea. We do want to make sure people have the access to get vaccinations.
Right now, it's still unclear how insurance providers fit into the new equation. Hubble says if patients have to pay out of pocket, he's worried it will prevent them from getting vaccinated.
The other part of that is, the other second thought was, are the insurance companies going to pay for the vaccine? So that's a big question mark. We'll find out as time goes on. But I'm hopeful that the insurance companies will make the right decision, give those patients the right choices.
But the Oregon Health Authority says it's working to find more answers.
Our goal is to ensure continued access to vaccines with no out-of-pocket costs to consumers in Oregon. And so, again, there are various levers that we are actively exploring alongside our partners to ensure that, but that is the principle at the base of the alliance.
The OHA said when it comes to public health, it's essential that the public has access to trusted scientific information. And Dr. Hathi says this is what the Western Health Alliance promises to provide.
We know that when guidance about vaccines becomes inconsistent and politicized, it undermines public trust at precisely the moment we need it most.
Dr. Hathi said we can expect to see some recommendations start to roll out from all three of these states in the coming weeks and months. But of course, there are still a lot of unanswered questions here about how exactly the Western Health Alliance will operate. And we'll be sure to keep you updated as we continue to learn more information. But for now, reporting live from Southeast Portland, McKenna Marks, Fox 12 Oregon.
McKenna, thank you.